I was the first dentist. I'm not talking periodontist, I'm talking dentist. I was the first dentist in the United States of America to purchase a dental laser. I had the first dental laser, and I've had probably half a dozen different dental lasers. I had an argon laser, CO2 laser, diode laser, and we still have 3 or 4. Doreen, how many lasers do we have? At least 3 or 4 different lasers in the office. Because each laser does something different. So each laser has its frequency and is beneficial for different procedures. So mostly I use the Millennium or LANAP laser. I love it. You know, it's great. When a patient comes in order to determine what's going on, I take a sample from under their gum, a subgingival sample of plaque. And I look at that plaque, and I look for parasites and organisms that we see with periodontal disease or gum disease. So that's what I do. Here's the microscope, and that on the left is an amoeba. And we see amoeba, we see spirochetes, we see spinning rods, we see gliding rods, we see trichomonads, all of those things we can see that indicate there's infection. How would you like this going on in your mouth? And this is what we frequently see with patients who have periodontal disease. That's a trichomonad, that little thing crawling around looks like a mouse, and lots of spinning rods and gliding rods, and there's an amoeba in the upper left. So these patients come in. Now some of them aren't as bad as this, and some of them are worse. These patients come, they have no pain. I don't know why I'm here, doctor. My doctor sent me here. When I show them this, their eyes open really widely, and they said, get this stuff out of my mouth. Because gum disease, if a patient comes in with pain, they generally don't have periodontal, it's not periodontal pain typically. It's usually endodontic pain or traumatic occlusion. But generally, if a patient's complaining of pain, I'm looking, besides the perio checkup, I'm looking for something else causing that pain. Because periodontal disease doesn't cause pain, which is why most people lose their teeth from periodontal disease. It doesn't bother them. And by the time it's bothering them, well, these teeth are getting loose, it's too late. You've got to pull those teeth. And we send them to Dr. Katranji, who then puts those teeth back in. We use the laser, and not all the time, but we sometimes, and not infrequently, get bone regeneration by destroying the bacteria and stopping the infection. I don't cut away the tissue if I can avoid it, because cutting away the tissue leaves those teeth sensitive. It leaves spaces between the teeth. The patients are really unhappy. You know, they don't want to go through that. And they don't need to go through that if we can stop the infection. It's the infection. The infection is caused by parasites and bacteria. And if you can stop the infection, you don't have to destroy the tissue and cut away the gum. So I tell the patient, look, I'm doing half the treatment, you're doing half the treatment. My half is stopping the infection. Let's call it curing, I don't know, stopping the infection. But if you don't do what we teach you, the infection is going to come back. And so it's all about their home care. It's absolutely critical, because if they don't do it, it's going to be a problem again. And we work on that, and we work on that, and we work on that. And we don't let that patient go until we know that they're doing their home care properly and there's not a drop of blood ever coming from their mouth. And then we see them for some follow-up appointments to make sure they're not getting lax about that. Typically, we get bone regeneration. It takes about 2 years from the time we do the treatment. It takes about 2 years before we're seeing the bone regeneration. This was a great result. Again, it's about 2 years. You know, the tooth is basically, it would be looked upon as hopeless. You'd think it needs endo. We didn't know endo was done. We simply treated it with a laser to eliminate the infection. Here's another example of bone fill. This is an implant. We can get bone fill, and there's another area of bone fill in the maxillary anterior. Here's some bone growth around some implants. And, you know, I have patients who come to me like this, and these patients have been told they have to have all their teeth out. These patients don't want their teeth out. They'll do anything to keep their teeth. And we can keep their teeth, not all the time. Sometimes we can't. But in cases that frequently look hopeless, they're not as hopeless as they look. And if we can stop the infection, it's all about stopping the infection, we can prolong the life of the teeth and often save them for many, many years. So the real problem to me is not just the loss of teeth. These organisms get into their bloodstream. They're now strongly linking periodontal disease to the initiation and progression of Alzheimer's. We know it increases heart attack risk. We know it increases stroke risk. We know it increases the risk of diabetes. It makes diabetes worse. Diabetes makes it worse. Pancreatic cancer is almost 60% greater in men who have periodontal disease. I mean, there is no part of your body that isn't affected by the infection, and you saw that infection going into your bloodstream and traveling throughout your body can shorten your life by 6 to 7 years, depending on how severe it is. This is bad stuff, and people don't know it because it doesn't hurt. This is the other silent killer. High blood pressure is the silent killer. Everybody knows about that. Not enough people know about this silent killer because it's really, really true.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.